The opioid crisis has touched every part of our country. Nobody wants to live in pain, but nobody should be putting their health at risk in order to live pain-free. I'm Jacqueline Andriakos, and I'm the health director at Women's Health Magazine, and I'm joined by American Physical Therapy Association spokesperson and physical therapist, Sarah Wenger. Thanks for being here.
Thanks for having me.
I'm excited to cover this. It's an intense conversation that we're having. If you have any questions during our chat, then please comment on the video, and Sarah will be happy to address those. So the reason that we're here today is to discuss the benefits of choosing physical therapy for safe pain management and to combat the opioid crisis. We know that the opioid crisis is a huge problem that's really spanning all of the U.S. right now. But what are some of those risks of depending on pain medication long-term to deal with pain management?
Yeah, so I think, people are pretty familiar with addiction and overdose and abuse that's happening. There's lots of reports out there on that. But I think it's a little less clear like how people end up in that situation. And I think there are a number of side effects to opioids that kind of steer people down that path. So one of them is tolerance, which is when your body gets accustomed to using it, and then you need more and more, a higher and higher dose just to get the same amount of pain relief. So obviously that puts you at higher risk for addiction and for overdose. But I think that when somebody is in pain, right, it's scary. It's really scary to stop taking your pain medicine. Like, you're in pain, you have a pain medicine, so it's really counterintuitive to stop taking a pain medicine. So if you have a surgery or an accident and you have a short amount of intense pain and you take opioids and then the pain goes away and you stop, everything goes smooth.
Right.
But if that pain doesn't go away after that initial injury, or if you had underlying pain problems that maybe were untreated and now all of a sudden they're being treated by the opioid, it can be really, really hard to come off the opioid. And I just think it's so challenging for people and scary for people to come off of a medication that is at least giving them temporary relief from their pain. So long term, and it is effective short term, right? So long term is when you start gathering all of these side effects, and that's when it starts becoming problematic. So
I think that's a great point that you make, that it's not that these drugs are wrong or horrible or bad, it's the misuse that becomes the issue. And I guess the big question is, where are those other interventions? What are those, and how do we balance this out?
So the other interventions are, there's many of them, and we always encourage people like multidisciplinary care, interprofessional care. Like, getting pain from a physiological standpoint is complicated, and there's so many different things that contribute to it, like, that might make it last longer, might make it more intense. And so because there's so many different things feeding into it, you kind of need a bunch of different treatments to address all those different things. So it's really important to have, it's really important to have good medical care. It is really important to have good mental health care, because pain is so stressful, you know, and it makes you feel bad, and then you're not doing the things you want to do, and then you feel bad that you can't do for your children, or you can't perform well at work, or you're just not serving in your life roles, and it hurts and it's uncomfortable and it brings you down. And so I think getting help with mental health is super important. We're the movement people, so obviously...
I was going to say, where does the PT play into this?
So, when you're in pain, moving is hard, and you end up with this bad relationship with pain where you're scared to move because you're worried that it's going to hurt, and you don't know what's safe, and you don't know what isn't safe, and you end up doing less and less, and as you do less and less, you can do less and less. You get weaker. Maybe you gain weight. You get more pain. You get more depressed. All of your body systems are dependent on good fitness to function well, and as your fitness gets worse, you can get other illnesses. If you have other illnesses, they won't be as well managed, like high blood pressure or diabetes or something like that. And so you get like less and less and less healthy, and movement is how you get yourself back to being healthy, but it hurts and it's scary. And so what we do as physical therapists is really try to work with people to help them, move, be fit, be strong, lose weight, have good balance, move with good mechanics. I always say, everybody knows you're supposed to lift with your legs and not with your back, but just nobody does it pregnant women and people with like acute back pain. Nobody else actually does it properly.
I'm putting my, carry-on in the overhead, and I'm like, well, do I do that with good form?
So I think there's a lot of things that we can do to take better care of ourselves and to make the activities we're doing a little bit easier on our bodies. So there's things that we can do to stay active, stay in the game, keep doing our jobs, keep taking care of our kids, keep being sociable, keep playing our sports, whatever it is that we're up to. There are ways that we can get people doing those activities so it's less stressful for their body, they're more able to do it, and most importantly, that they don't wake up the next day just regretting that they did it. Yeah.
And when I think of physical therapy, to be completely frank, it sounds sometimes time-consuming. You are a busy working individual, you've got kids, you have obligations, and you think, okay, I have to go to that appointment, I'm going to have homework. What is your response as a physical therapist? What is your response to that?
Yeah, I think there is a time commitment, and I think, long-term game, a little bit of investment now buys you a lot less suffering and, a lot less being limited in the future. But there are people who can't, especially when you have kids and, if there's a lot of stress and strain in your life, it's really hard to think about the future when right now is just putting out fires,
Right.
So I think it's really important to just be honest with your provider, whoever it is. But certainly with your physical therapist. Like I can't commit to 3 times a week. I can't commit to once a week. Like your provider should work with you based on what you can do. I always teach my students, like, you might not be able to come in and fix everything, but don't just give up because you can't make it all perfect. Give whatever help you can give. So
every little bit counts.
Every little bit counts. Like a little bit better is a little bit better.
Yeah, and I love that. That's a great way to put that.
So if somebody can only come once a month or once a week, that we're trying to work with them, give them things that they can do at home, and that's when it's really important to focus on education and making sure that people have things that they can do on their own, in their own time schedule, whenever they have a second, and that you're not making those things super time consuming.
I love that you mention that you should have that conversation with your provider. This is my schedule, this is what I'm working around, this is my primary goal, we'll deal with all the other aches and pains later. How important is it to make sure that your rapport and your comfort level is really there with a provider?
I think it's hugely important. So there's actually research that shows that if you build a good therapeutic alliance, that you will have a better outcome regardless of what the treatment is. And that goes across professions too. There's also evidence that if you believe a treatment would work versus if you don't believe it will work, that has a huge influence on outcomes, again, regardless of profession, regardless of treatment. So I think being able to build a good rapport with a patient, build a good alliance with a patient, and then really being able to engage them in the plan of care, but also choosing a plan of care that they can engage in, like something that jives with your patient. So I think sometimes patients have to budge a little bit and get a little bit outside of what they were thinking to begin with, but so do we as providers need to give a little and make sure that, the treatment's effective and it has good research to support it, but that we're really doing something that's stylized for each patient. Because if they have a good rapport, they'll, if you trust the advice you're giving and you believe the advice you're given is going to help you, you are considerably more likely to do it. And I can give you the most amazing advice in the entire world. If you don't do it, it's not really very amazing.
Right. There is some onus on, yourself. You have to show up in your appointment and you have to show up at home and show up for your health. It's, you can give the skills, but if I don't actually apply them, then that's kind of on me.
Well, I think it's on both. Yes, that at the end of the day, yes, it's true. I can give you all kinds of information. If you don't do it, it's not going to help you. But at the same time, I think me as a healthcare provider, I need to give you things that you can do. Right. I need to give you things that you understand. I need to give you things that are sort of scaled for you and that click enough with you that you can engage in it, and it's my job to sort of size that up. So sometimes, like if I'm talking to a patient and they're kind of like checked out or glazed over or just kind of shaking their head, I might just pause and say like, I don't think you're buying what I'm selling.
Right. And let's address that.
Yeah, let's talk about this. There's no point in me going and going and going when I don't have an engaged person listening to me. So I think the answers you get to that are all over the place. Like sometimes people just have a belief that is contradictory to what you're saying, and then you need to like go and unpack that a little bit. Sometimes people have completely legitimate reasons why your suggestion is bad. Like I might be asking somebody to, like might be teaching them how to get their kid in and out of the car seat, but there's, I'm thinking they're in a car like this, but they're in a car that's really high or something like that. Like or they have the car seat arranged differently than what I'm thinking. So sometimes people will say, well, I can't do that because of this, or they'll just tell you about barriers that are in your life, which of course I'm not going to know about unless
they communicate those.
Right? But given that information, I'm like, oh, well, that makes me actually want to give you a different plan. So I think there's a lot of back and forth.
And I think what I find really fascinating about these elements of belief and perception and conversation, when I think of an opioid, I think, okay, I'm going to take that and the sensation of pain is gone and I feel great. Is that not a great way to be thinking about pain? Because I'm listening to you sort of give all of these examples of what you can learn through dialogue. And do you have patients who are walking away perceiving and thinking about pain differently?
I hope so. That's certainly my goal. I think this idea that you're going to have zero pain, okay, if you're a kid or you're in your 20s, that's a relatively reasonable goal for the most part. If you don't have any health issues.
We'll give it to that demographic.
But I'm 47, right? I don't have zero pain. I have arthritis in my knees, and you're always going to have pain with time and with injury.
It's a part of life.
It is a part of life, and it's particularly a part of aging. It's not a part we like, but it happens. So I think this idea that I'm going to take a pill and then I'm going to have zero pain, and I can only get back to my life and only function and only be happy if I have zero pain, I think is a unrealistic belief, but it's also not super accurate, right? There's plenty of people who have pain, who still engage in the activities they want to engage in. They're happy, they have good lives, they still do what they need to do. It's not perfect. There's pain, but they're doing what they have to do, and they're satisfied with their life. So I think that that's a better goal for patients. And I think pain treatment's really hard when patients are very, very stuck on this idea of zero pain. Because it's not, I can't give that to them. And if I can't give it to them and then they're not sort of buying in or engaged in what I am giving them, then it's hard to help. And so I think sometimes I spend the first while of therapy just kind of getting to know people and talking and just trying to shift some of their beliefs and some of their ideas and expectations. And maybe I really need to focus on that before I even do any exercise.
Something that we discuss a lot at Women's Health and that is very relevant to our reader is the reality that for women, their pain is not always taken seriously. Is that a conversation that comes up with some of your patients that are women?
It comes up with my patients who are women, who are people of color, who have biases against them for whatever reason. So I think it's huge. There's definitely some publications out there right now about it. And if you go to somebody and you explain your symptoms and you explain your pain and they're not hearing you or they're not believing you or both, how can they give you good treatment? So I think it's a huge issue. I think there's a lot that patients can do to advocate for themselves and to kind of make sure that they're heard. But I also think it's okay to skip that healthcare provider and go to somebody
Move on to someone who hears you and sees you and can empathize. And when you mentioned the advocacy element, what are some of those ways that you would suggest to someone, whether they're going to a physical therapist or going to a doctor, to really have their voice heard?
So I think the best thing is to really kind of, live stream your opinion as you're listening. So if the healthcare provider is telling you, giving you advice, and that's not clicking with you, and you're not telling them, how are they supposed to know, right? They need to know. Or if they're telling you something and you're thinking, gee, that's not going to work with my schedule, again, you're going to have to say something for that provider to know. And is it ideal if the provider asks you all the right questions and gets all of the information? yes, but it's not super realistic. Like, there's so many things. Like, as a physical therapist, there are hundreds of things I could be asking about. So I can't just sit there and ask about every single little conceivable thing that might affect your pain. So I can ask about, like, kind of the common things, and I've been doing it for a long time, and I can kind of get a vibe of who you are and try to angle my questions, but I'm never going to cover everything. So I think it's really important for patients to say, like, if you're not going to do it, just tell me you're not going to do it.
Yeah, you know? I love that. Just let's be blunt.
Yeah. Like, just if you're like, I can't, that's not going to work for me, then I will come up with something else. I might not like it as much. I might not think it's as beneficial. But again, giving you something that's not quite as good is better than something that's excellent that you're never going to do.
Absolutely.
Yeah.
And I'm curious, do you have any real stories that relate to everything we're talking about? I'm sure the answer is you have many, but if there's anyone that sort of sticks out in your mind.
Yeah, so I have a couple, I'll do a couple little tidbits. I had a patient once who she was just one of those people that just had to have a clean house. It had to be clean, it had to be clean, it had to be clean. She had back pain, and she was bending over and wiping things up whenever she saw them, right? And she had a husband who was not the neatest and was dripping things on the floor, and so she was bending over a zillion times a day, wiping things up off the floor. And we did a bunch of stuff in therapy, and we worked, and I was like, you know, at the end of the day, if you're bending over 100 times, your back's going to be sore. She also had knee problems, so she couldn't squat down. She was bending over. And so she was like, I can't, like, I'm gonna go crazy if I have a bad house, a dirty house. So we basically worked on, I'm like, well, can you wait for there to be 2 dirty things on the floor, and then, like, maybe get a mop, or maybe sit down, maybe put a stool so that you can wipe it from a stool. And so it took like a couple of months for her to really give up, you know, like, okay, I'm gonna just let it go, and I'll mop it twice a day instead of bending over every single time to do it.
I feel like, in a way, you're almost like an accountability, habit-changing life coach, too, on top of, you know, improving movement and helping ease pain and symptoms.
Yeah, I mean, I think that's part of improving movement is sort of looking at how you dose it. So this same patient, too, she really learned how to, you know, well, I started mopping, but it hurt, so I took a break, and then I mopped the rest of the floor. And it's so simple to say, like, oh, do it for 10 minutes and then rest and then do it again. But it is so hard to do. Like, who wants to leave a floor half mopped or half vacuumed, or who wants to, you know, do half a task and then walk away from it and come back? You just, like, I'm in it, I'm here, I'm going to get it done. I just want to get it over with and get it done. And so even though we know it's good for you and you know you're supposed to be doing it, it's just so hard to execute those changes. And I think I work with patients a ton on that. You know, so sometimes they'll do it and they'll be like, oh, you know, I cleaned half my house and then I left the rest of it for the next day and I feel better. And so I usually try to encourage people, like, if you do it and you get a good response, it just gets easier and easier to do.
Absolutely.
But I think I have a lot of patients who've just really, the big hurdle has been that behavior change piece, like really just executing it.
And so you get to physical therapy and you start learning these tools, that's great. I feel like we have to talk about getting there, the access. This is something that too many people might not have access to. Where do you see room for improvement?
So I think most insurances cover some PT. A lot of them have very expensive co-pays. So I think one of the things that would be extremely helpful in terms of access is if co-pays were lower for therapy. It's one thing to pay a high co-pay when you're going once a year or twice a year, but, you know, PT can be a couple times a week, and if your co-payment's $50 each time you come, that can be a lot of money, and it can be really unaffordable for a lot of people. So I think reducing co-pays is huge. I also think sometimes reimbursement, sometimes you'll get like a set number of visits, and sometimes you'll get a set time frame. So you can have 60
use all of
days.
those visits within that time frame.
Yeah.
Got it.
And I always say I'd rather be limited in visits than limited in time frame, especially for chronic things, right? So if you sprain your ankle, sure, whatever, limit me to a time frame. But if you have chronic pain or you have a chronic disease of some kind that isn't going away, or even arthritis, which doesn't go away, I'd much rather see you once a month for a year than 3 times a week, for a month, because I'm teaching you to manage it on your own. So I don't necessarily need to see you with high frequency, but I should be able to touch in with you at different points to help you manage this chronic thing. So another area, of course, is that there's so many people that aren't insured, and I have the absolute luxury of working in a pro bono clinic, so I don't have to deal with insurance at all, which is extremely liberating and wonderful.
Yeah.
And there are pro bono clinics throughout the country, mostly associated with universities.
Okay.
But I think there is a whole population of people that really don't have access to PT because it's not an emergency service. And if you don't have insurance, there's places that will take cash payment, but that's really not attainable for a lot of people.
And where are you going to find a list of what's in your area if these clinics are somewhere that's accessible to you?
Yeah, you can go to choosept.com, which is the American Physical Therapy Association's consumer website, and there's a Find a PT feature on there, so you can go in and type your address or zip code or whatever, and it will tell you what PTs are nearby, what kind of insurances they take. They'll tell you if it's pro bono. So like I'm in there and it just says pro bono under it.
Look up Sarah Wenger. Well, I think that is all the time that we have. I'm being told we're done.
Okay.
If you do have any questions, and we did not have time to get to them, comment on the video and visit APTA for more information about how to choose PT and live life pain-free, but also in a safe way. And for much more about pain management, the opioid crisis, you can also check out womenshealthmag.com. Thanks so much for tuning in.
Thank you.